Why has the CDC's flagship journal been so quiet? Morbidity and Mortality Weekly Report, or MMWR, published half as many articles in the past 3 months compared with the same time period in years past, according to a MedPage Today analysis. So, what's going on?
I looked at the number of overall MMWR publications for May, June, and July of several years going back to 2018, and I compared those with May, June, July of this year. And note that I skipped 2020 and 2021, figuring COVID likely led to an uptick in publications. So basically, we found that the publications were halved this year compared to prior years. 35 in May, June, July of this year, compared with 76 on average during the same time period for the other 5 years. One, that submissions are down. And two, all MMWR articles must go to the HHS Secretary's office for review before they're published. Yes, that means someone from Robert F. Kennedy Jr.'s office is reviewing every MMWR before it goes live. I learned this from Dr. Michael Iademarco, a former director of the CDC Center that oversaw MMWR, and he still has sources inside the agency. They told him that submissions have indeed dropped off, and we don't know the reason for that. We know that many people have been fired from CDC, so there are not as many scientists to write the reports, and scientists may also be hesitant to submit their work to MMWR for fear of interference. Iademarco said he knew of 2 examples where that actually occurred. And of course, with Kennedy's office overseeing all articles, it's not hard to believe that that could happen. My sources in infectious disease really lament the MMWR changes. Dr. James Lawler, a director at UNMC's Global Center for Health Security, said that squeezing MMWR, quote, hurts all of us. It makes us less safe because our hospitals and healthcare facilities and public health professionals are going to be less informed.